it's really very sad to hear the story of that medical student died because of the heart transplant. So many times, even the clients coming for the consultations, we advise them the importance of having a proper setup and qualified surgeon for doing a heart transplant. Uh, when selecting a surgeon, lot of times we just carried away with seeing the advertisements given by the non-medical professionals, and not even going into the depth and understand what their qualification is and whether the setup is adequate to adequate to perform a medical procedures. And we actually Indians are really very poor in selecting a doctors. If you see any international client, when they come to us, immediately, even the mail conversation, what they ask is whether the hospital has set up to manage any emergency issues, whether they have ICU facilities, whether they have ventilators to help the sick people. Basically, the human body is not like a machine. When you do something, it has to work. Nothing like that. Each body is different. Each human body is different. They react to the procedure differently. Though the cosmetic surgical procedures and hair transplant are very safe procedures, there might be a time where it might go wrong. But only what you have to understand is the surgeon whom you are believing and going has the capability to manage the consequences, what happens because of the procedure. Each, as I said, each body reacts differently. That might have mild infection, that patient have mild collections. He needs to know how to manage it. And the whole medical curriculum, even after 5.5 years of the MBBS and 3 years of any specialty degrees, we learn a lot about the sterility. Each time when the surgery gets over in a operation theater, we take half an hour to clean the theater and sterilize the theater before doing the next surgery. And obviously, you can't expect this kind of a sterile environment in a saloon based settings. FUE, what happens is multiple punctures we do using a drill bit to remove the each hair follicle separately. Sometimes we make 2000 to 4000 punches to remove the hair follicles in the back and insert in the front. If the punches is contaminated, think about 4000 punches we are making, and 4000 times you are trying to infuse the organism inside the scalp. So, only the sterility plays a major role in FUE. Though people say that it's a scarless procedure, it carries its own risk. 4000 times when you are punching a particular the back of the scalp, if the punch is contaminated, think about the amount of infection we are going to introduce. So, if a surgeon does the same procedure, he knows about these issues and he makes sure that it's a sterile one, a disposable one, and he uses it only for the one patient and throw it the remaining things. Even the FUE that handle needs to be ETO sterilized every time before using for a procedure. So don't go away with the advertisement saying that scarless procedure, free from everything. First, what we have to understand is select a good surgeon, select a good hospital to perform the procedure. Never ever compromise the quality of the procedure. And only because of somebody is offering a cheap hair transplant, don't go to that place. And it's very disappointing to see nowadays a lot of technicians are doing the hair transplant, lot of untrained professionals coming into the picture and doing the hair transplant. And they though that rates are so much very low compared to the doctors doing the hair transplant, but you should not get into trouble just because the cost is low. So take care, guys. Select a surgeon properly. If you see, the medical council is taking a lot of initiatives to make sure that the unqualified professional should not do it these kind of a procedures. Even all the doctors, we apply medical council, they give a name board, and like it carries the doctor's medical council number, and even if you have any queries, you can check with the medical council before going and meeting a qualified professionals. Medical council has all their degrees, whether they are MBBS, they have finished the general surgical training, they have finished the plastic surgical training. Everything you can inquire medical council before going to a doctor. Thank you so much.
And with the latest public attention that this unfortunate incident with the hair transplant has been garnering, I've been asked a lot of questions by my friends and patients and asked to tell them what could have gone wrong and what could have been done otherwise to have avoided the situation. So I'm making this video for you. Okay, the first thing, what is hair transplant? How would I put it down? Whether it is a surgery or whether it is a procedure or whether it is something else. Okay, to start with, the hair transplant is done in different methods, and the most popular successful technique, which is the stiff method, obviously involves cutting a piece of the skin out from the back and suturing, so that definitely qualifies as the surgery. But the one that is gaining more popularity nowadays, which is the FUE method, involves taking a punch, putting a punch inside, which is a small hollow blade, and extracting out your hair with a little bit of skin, which is processed, and that skin in both techniques is placed in front by again making a small hole with a front punch and then placing the hair. And though it does not involve cutting and stitching, but it is not as simple as doing a tattoo. So I'd rather say it is again almost a surgery, if at least not at least it's a major procedure. So what could have gone wrong in that person's case was the next question. Well, since this is a procedure, if it's a major procedure or more technically a surgery, anything could have gone wrong is the right way I can say that. Right from the beginning, when we get the patient in, he could have developed an allergic reaction to almost anything that is used in everything that is used in the surgery, like the cleaning solutions, the local anesthetic agent, the IV fluid that was given to him, the numbing medications, or the antibiotics. I've had patients who developed allergy to the material on which they have been lying on to actually, or it could have been an infection that was already in his scalp and had gone in, or maybe something else in his body, and there are so many things there that could have actually gone wrong. And what could have been done? A person who should have been vigilant, either him or should the treatment providing persons should have been able to watch, look for it, and make sure even if such a complication had occurred, they had taken the remedial measures. So now, as an individual person, as an individual practitioner, I can't go and proclaim dictums as to who should do this procedure or where this procedure could do. But I can definitely do something that would benefit you patients, which is where the procedure should, which is you making the choice of who should do your procedure and where this procedure should be done, and first of all making the decision whether you need the procedure. Okay, so for making the decision as whether you need it and again who should do it, and it should actually be a surgeon preferably, and a plastic surgeon better, because we do an MBBS, which is 6.5 years, another course of surgery, that's 3 years, and another specialty course in plastic surgery is a total of 12.5 years for the most brilliant of the guys, and usually around 13 to 14 years for a regular plastic surgeon to get the degree and the mastery in not only doing a hair transplant but also to understand the physics and the chemistry or the science behind it, and understand how things can go wrong, find whether if things have gone wrong at the earliest, and most importantly, treat them or have them managed. The second thing, again, since I say that it is a major procedure or more preferably a surgery, it should be done in a operating theater with you being monitored all the time. or at least in an ideal setup in a dedicated sterile environment in the surgeon's place, where there is provisions for the early anesthesia, where there is provision for having you monitored throughout, and also a provision to keep you monitored for some time after the procedure to make sure that there are no problems. As I told you before, if things can go wrong with anybody, and if things have gone wrong with me, the things that I normally do to avoid it are, I am a plastic surgeon to start with. I do the procedure all by myself. The procedure actually takes 5 to 8 hours. There is an anesthetist involved, but he is there for the initial few minutes while I give the local anesthetic agent to the patient, which involves injecting him multiple times. So the anesthetist is there to give you a mild anesthesia for those few minutes where multiple pricks, sometimes up to 20 injections that I give to numb your scalp up. After that, it is going to be my technical team that is going to assist me with either the harvesting of the hair and then placing up, which can take 6 to 8 hours. All through the procedure, you are monitored. Multiple parameters in your body are monitored. You are going to talk to me through the procedure, and everything is done in a sterile environment, in a sterile method. And after the procedure, you continue to be monitored for a couple of hours. You are given my contact details so that you can contact me anytime if anything goes wrong, about things that can go wrong, which you are educated before the procedure. And you are not allowed to travel quite a long distance on the first day, and you're supposed to contact me immediately, and I'll be there to take care of you if I feel, or if you feel anything does not look good or is out of the ordinary. So the choice is yours, and it should be an educated choice, not a choice that makes you feel that you've been educated enough. So when you're looking for the surgeon, make sure you look for his credentials, make sure he's an expert. Expert in the sense not only in the technique but also in to look at you and take care of you before and after the procedure. Make sure you have a look at this facility where you're getting operated. It should preferably be a sterile operation theater with monitors and facilities to take care of you after the procedure, or at least a dedicated facility where something like this is available.